All right, guys, so sciatica is something that patients come and see a chiropractor for all the time. So let's dive in and talk about it. Now, sciatica, really, there's two kind of main definitions of what sciatica is. And if you come closer, what you can kind of see here is this is the backside of a person, and these guys right here are your sciatic nerves. Now, what true sciatica is when the nerve is literally being dragged along the bone. So if you look up a medical definition, that's what sciatica is. Now, the second thing is that the muscles, meaning the muscles in the glutes, can actually push down on the nerve, and that can create sciatica, which is basically numbness, tingling, and pain going down the back of the leg. Now, true definition of sciatica, honestly, and I'm telling you because I see thousands of patients a month, these guys, it's like 1 to 3%. It's very, very minimal. This side, this is what they call piriformis syndrome, and this is super, super common. I would say people that have lower back pain and quote unquote sciatica, this is like 85 to 90% of the time. The other, 5 to 7% usually could be some sort of like disc issue or something else, but this is really, really what's important, and I'm gonna teach you guys how to fix it right now. Okay, so when we talk about piriformis syndrome, what we gotta do is we gotta get the muscles here and the glutes, which sit on top of it right here, to loosen up, because typically they're in spasm because of a pelvis being rotated out of position or sitting for too long, and it's causing pressure down the back of the leg. So I wanna show you guys my favorite way to address that as well as stretch it. So we're gonna go to the ground and we're gonna talk about it now. All right. Okay, so to target the piriformis right here, what we're gonna do is you're gonna use a tennis ball, lacrosse ball, or some sort of massage ball, and we wanna roll on this thing back and forth and apply a lot of pressure. So here's how you find it. What you're gonna do is the affected side, you're gonna bend the knee up to 90 degrees, and then you're gonna place the ball just like you would be putting it in the back pocket of your jeans, but we're not gonna put it in the back pocket. We are gonna then take the ball and we are gonna roll our body over the top of it. Now here's kind of the key, guys, is that once you start sitting over it, we wanna roll around in a 360-degree angle. So pick the butt up and actually roll back and forth in a 360-degree angle. You'll find that that area is extremely tight. Why? Because the muscle's in spasm. So what we wanna do is hold it over those tight areas for like 10 to 15 seconds. Just breathe in, breathe out, accept that it's gonna suck, it's gonna be tight, and then try to move about a 1/4 inch around that piriformis muscle. Now, after that's done, you're gonna take the leg, kind of shake it out a little bit, and then we're gonna stretch it. So here's how we do that. Again, affected side would be all right, this side. We're gonna take the knee, we're gonna bend it up, we're gonna bring it over the opposite leg, and then we're gonna take both of our hands and we're gonna hug it into ourselves. Again, what you'll notice is that there's an extreme stretch right through the glutes and right through the piriformis muscle. If you guys do that, what you'll notice is that muscle will start to release, your pain down the leg will decrease, and it'll take tension off of the sciatic nerve. If you guys have questions about sciatica, if you've experienced sciatica, please let me know the things that you've done. This is what we do with our patients day in and day out, every single day, and it helps a lot of them. All right, until next time, guys, talk to you soon.